So let's talk about blood donations,
Yeah,
right?
because
So
on my
blood
channel,
banking.
as you know, we've talked a lot about blood donations, and most experts that have been on the channel talking about high hematocrit and so on, we've always said no need to donate blood on TRT. So now you're saying other things.
So, and again, we're not going to base those recommendations on the hemoglobin hematocrit. And I've done multiple podcasts on that subject. We've never had a study, a very powerful study that shows that high hemoglobin hematocrit increases the risk of blood clots or heart disease. We've never been able to see a study for this. Most studies show that long-term testosterone is beneficial. The studies that showed that maybe there's an increase in blood clots, most of those patients had a blood clotting disorder, some kind of hemophilia. So we've never seen that. So based on the hemoglobin hematocrit, that's not where I'm putting my recommendations to donate blood. It's not based on the hemoglobin hematocrit. Although I'm going to tell you, as somebody who's on testosterone, and I did experience a higher hematocrit up to 53, I was symptomatic. I felt a heavy head, a little congested, a little more hot flashes. And then when I donated blood, it felt better. So I felt the symptoms. Some people get their hematocrit up to 56, 58, and they have no symptoms. But I've seen many patients with high hematocrit that their blood pressure is a little higher. They complain of a mild headache or buzzing sound. They get hot flashes more often. They don't feel as well, maybe a little more palpitations. So low iron is bad. High iron, when you think about the dynamics of blood, if you have thicker blood into a fixed vessel, you don't want that. You want less viscosity. So I'm not recommending, because so far we haven't had a clear answer. And when I have discussions about this, we can say yes or no if it's harmful. We don't know. So high H&H, so far we haven't had a study that's powerful enough to let us know if we need not to worry or should we worry. Right now, because we don't know, we said most studies don't show an association. But there was a study that was done by Dr. Ramasamy at University of Miami. And it did show, it was a small study, and I forgot how many people, but it showed that guys who have high H&H the first year after starting testosterone tended to have a poor outcome cardiovascular-wise. It was a very small study, and his conclusion said that, well, that study points that we need a more definitive study. So right now, I'm going to stay with the same. Based on level of hemoglobin and hematocrit, level of secondary erythrocytosis, this is not where I recommend to donate blood. Although, as per the American of Endocrinology, hematocrit above 54 was found to have adverse consequences. So what I do at my practice, if your hematocrit goes above 54, I cite the American Endocrinology Association, and I recommend for my patients to donate. And I'm going to tell you why it's important to do this as providers, because we have a friend that had a patient that had a heart attack and a stroke with the hematocrit being in the 56, and they went after him because they say the guidelines in the US show that if hematocrit is above 54, that you should either change the dose, decrease the dose, and recommend blood donation. If you don't do this and the patient has a bad outcome, you cannot be protected. So for all the providers out there, although we don't have full evidence, the American Endocrinology Association has this, and it's a standard of care that it's above 54 and there's a bad outcome, you may be exposed.
Okay.
Now, if we're going to talk now about the ferritin level and the reason for blood donation, we have a lot of evidence. I cited the FEAST study, iron in atherosclerosis study, where they followed 1,700 patients for 6 years, and they showed that phlebotomy, reducing the ferritin in the 40 to 80 range, definitely, and it was statistically significant, decreased the endpoint of death, heart attacks, and stroke. And the earlier, the better. And earlier, I mean those patients are between 43 and 61. Strong association. It also showed a decrease in cancer. Strong association. If we look now at the Scandinavian heart study, the Copenhagen heart study, you look at the level of ferritin less than 200 associated with a higher range, a higher mean survival death. If we look now, there's other studies that show that frequent blood donors, and frequent blood donors are 2 to 3 times a year, live on average longer than non-life, non-blood donors. And I have all of those studies. Again, Stephen, I told you I'm going to create an iron class where I'm going to be able to get all of this for any patient who's interested with all the citations and really keep talking about this. So blood donation is important. And if we think about our medical history, we've always done some kind of blood donation, bloodletting. In the Middle Ages, the way doctors treat patients was by venesection. They cut your veins, let you bleed out. In the Victorian era, in the 1800s, we've used leeches. In Paris, there were hospitals. All they did was leeches therapy. People had their own leeches because they said it removed bad blood, mauvaise humeur, all kinds of things. At the end of the day, what we realized, it was removing iron.
Yeah.
So blood donation, multiple studies. I'm going to say there's a few studies. They've done a couple of randomized controlled trials to compare endpoints. And there's some studies that show that there were no benefits to blood donation, no harm also. But they just said, we don't see any positive. But we have those studies, the FEAST study, the Copenhagen study. You can go and look at those things and you see that there are a lot of data to support this. And then blood donation is something good. Every time me and my wife go and donate blood, I feel good the whole week because I feel like I've done something. So it's funny, in my iron presentation, I have a nice email that they sent to my wife after she donated blood. And they said the email came that your blood matched with a child at whatever hospital. Your blood is on its way to save his life. Makes you feel good.
Yeah.
It's a selfless act that's actually good for you. You know, every 2 seconds in the US, somebody needs blood. We're short in blood. So you do something good for somebody and you also dump iron, that's good for your health.